How to best protect your health during the fall season is top of mind this time of year. An infectious diseases expert, Dr. John Zurlo, is back on the podcast to help you decide whether or not you should consider the new COVID booster.
He also breaks down where he stands on masking to protect yourself and others, as well as the best time to get your flu shot.
Dr. Zurlo also offers reminders on what to do if you get COVID and breaks down long COVID with common symptoms and how to navigate the healthcare system as a patient.
Here's our conversation with Dr. Zurlo.
My name is Dr. John Zurlo, and I am the Division Chief of Infectious Diseases here at Thomas Jefferson.
The flirt variants of COVID are now the dominant variants in the US. What should people know about this strain?
Well, the flirt variants really are all part of Omicron. Now, if you remember, COVID broke in early 2020. Of course, it started in 2019. And we thought that we had vaccines and things were under control by the end of 2020. And then November or so of 2021, suddenly we had this very, very highly contagious variant, the so-called Omicron variant that really developed, I think, in South Africa, quickly spread around the world. And we were really inundated here in the United States and certainly at Jefferson, December, January, February of 21, 22. And then really every variant that has developed are part of Omicron. So the most recent ones are these so-called JN variants, and the more recent ones, these so-called flirt variants. And they're just slightly different in terms of their genetic makeup and how they're defined. And they're very similar really to Omicron in the sense that they're fairly contagious, but each time that they spin off these mutations, they tend to be just a little bit more resistant to the vaccine. So that remains the challenge.
So would the flirt variant be what's contributing to the, quote, summer surge of 2024?
Correct. Most of these flirt variants are what we're seeing. With that said, I mean, if you look at the way this virus operates, remember, most of these so-called respiratory viruses we see more in the winter. And COVID has kind of violated that rule a bit. We've seen outbreaks really through the entire COVID, that we see outbreaks that are occurring in the summer, in the warm weather months. We don't quite get that. We don't quite understand that. But if you look at, for example, looking at last winter and you look at the winter surge, it was much, much higher than the summer surge that we're seeing right now. I mean, a relatively small fraction of what we saw, for example, in December, January of this past year. So it's a surge, but not to the same extent.
And that kind of leads to our next question, that when people think of COVID symptoms, I think they're generally thinking of respiratory symptoms like coughing or flu-like symptoms like fever or body aches. However, it seems like there are other symptoms to be aware of. Can you talk about those symptoms?
I mean, in all honesty, that things haven't changed dramatically. A cough, it remains a very common kind of thing. I think people have been talking about with these variants, maybe we're seeing more GI problems, like diarrhea, nausea, and that kind of thing. But for the most part, it remains a respiratory illness with prominent respiratory symptoms. It's not clear that the symptoms or the problems are really any worse. That's always been a very difficult determination. Are varying spin-offs and these variants, are they more dangerous? Are they less dangerous? The challenge is the fact that now COVID has been around for 4 years, and something like 98% of the population has some degree of immunity. And so that obviously would affect the way any variant would affect us. The immunity has occurred because so many people have had COVID, but in addition, so many people have been vaccinated, often with multiple vaccines that have been developed. So it's difficult to determine whether a specific variant is truly more or less virulent than the original ones.
You kind of just alluded to it, but I was going to ask you, what are the best ways to protect yourself from getting COVID?
Well, vaccines remain very effective. And for people who are at risk for severe complications of COVID, people older, so 65 and above, people with chronic medical conditions, and the more you have, the higher the risk of complications. Add diabetes plus heart failure plus kidney disease plus liver disease. Each of them add just additional more risks for severe complications, hospitalization, intensive care, and even death. And certainly immunocompromised individuals, organ transplants, people on immunosuppressive medications. All of those people should really maintain their immunity I'm sure we'll talk about vaccines later in this discussion, and I'll kind of give you an update about that.
I was curious what your thoughts are at this point on face masks. I feel like I have been seeing people wear them more in crowded restaurants and especially on airplanes. Is that something you
Well,
think we should still be wearing them or?
I think similarly, when people are in one of these risk groups, they should carefully consider their risk, not only their own risk, but maybe somebody who's otherwise young and healthy is going to be wearing a mask because perhaps they live with someone who is in one of those categories. And so I think people just have to make this judgment for themselves, what degree of risk that they're willing to take, particularly the kind of, especially indoor crowded settings where they may be exposed. I think those are the settings that people should consider masking in those situations. Outdoors, it's hard to imagine that masking would be all that helpful. Perhaps except if you're in a very, very tight crowd, maybe at a baseball stadium where you're around lots of people, even though you're outdoors. But for the most part, outdoors is probably a pretty safe environment for people.
How long do people typically stay infectious for after they test positive for COVID?
Well, I think at the outside, it probably is 10 days or so at the most. Probably as people, even after 5, 6 days, as symptoms start to wane and so forth, particularly if they've already had COVID, again, which is the vast majority of us, the immune response kind of quickly kicks in and probably makes them much, much less infective, even after about 5 days.
Because I had heard that sometimes it was if you were kind of like the flu, like fever free for 24 hours.
Well,
I
I
don't
think
know
it's
if that's
still,
accurate.
I think it's still the timing. Some people get COVID and they have no fever at all. For example, I've had COVID, I'm sure. Interesting. I never tested positive, but I had an antibody test. I most certainly had COVID. I had just routine colds. I never was feverish. So fever is just one part of it that doesn't always occur.
And I'm curious for people who do test positive for COVID, what are the best ways to treat COVID at home?
Well, we do have medication, this medication Paxlovid, and it's not for everybody. For example, if you're 30 years old and otherwise healthy and have COVID, there's probably not a whole lot of benefit because you're going to likely do very, very well, especially if you've been vaccinated. Again, we try and reserve treatment for, again, the same risk groups. If you're at high risk for complications, then we would suggest using that. Now, the downside of Paxlovid is that there are a lot of interactions with medications, so it has to be used very carefully. And it has to be given really within the first few days of symptom onset. So you develop symptoms, maybe a day or two later, you get tested, you're positive, maybe you fall into one of those risk categories, in which case then you should discuss that with your doctor, consider Paxlovid, but carefully review for interactions with medications that you may be taking because it could be a problem.
And at what point should you contact your doctor?
It still boils down to the people at the highest risk, but even at people with low risk, if someone has high fever, especially if they develop shortness of breath, maybe they have nausea and vomiting, they can't keep food and fluids down, they should certainly contact their physician and perhaps even just come to the emergency department and get evaluated.
And are there any other treatments for COVID?
Really no other that are in a pill form. For people who are hospitalized, there's this medication that came out early in COVID called remdesivir. It's an intravenous medication, which we now occasionally use. Once again, if we catch people early and they're particularly in a high risk group, especially with specific symptoms that are worrisome, then we will prescribe that for a period of a few days, of 3 to 5 days of treatment. We don't use that all that much nowadays, but it's still available.
Okay. And now to talk about the fall and what to expect for fall health and boosters. What is the latest information about this year's COVID vaccine, from when it'll be available to whether or not this will be a combination shot that would also include the flu shot?
So this is what I know so far. I mean, there's likely to be a vaccine from several manufacturers as early as August. It's possible within the next few weeks, certainly by September. They will be based on one of these variants, the JN variant or one of these flirt variants for sure, to boost the immunity that may not have been provided by the last booster, which was done last September, the 23-24. So this will be called the 24-25 booster. It'll be, as we call, a single valent. It'll just really aim at one particular strain of the virus based on these flirt variants. And again, all Omicron variants. I don't think there's going to be a combination vaccine. At least I've not heard that. It would be nice to get a combination vaccine of influenza plus COVID, save a lot of trouble, but I think there's still troubles in manufacturing. There's also this RSV vaccine that came out. There's now at least three different versions of that. That should be given right now, we believe, just once. We don't know that yearly updates of the RSV vaccine are indicated, but we may find out even as early as this year or next that, yeah, the immunity from the RSV vaccine wanes and you need to get boosters. Right now, that's not the case.
And is that RSV vaccine that's only for older adults, right? Is that for
Generally
60 and
speaking.
older?
Yeah, generally speaking, 60 plus, especially with chronic medical problems, for sure. So it's not for everybody. I think that's one of those vaccines that you really should discuss with your physician. What are the pros and cons of it? It's generally, so far, has been a fairly safe vaccine, but unlike COVID, where I think has a larger population of individuals, RSV is probably a bit more limited, I think.
So you mentioned RSV would now be the best time to get vaccinated to protect yourself for the fall season.
Correct. That's unlikely to be changed, and you can get it at any time right so far. And once again, if you've had it already in last season, which is the first season it was available, then you would not get a booster, just once and done.
And then when would you recommend getting the flu shot this year?
I always think that the best time is probably in late September, early October. We're always trying to bank on what's the right timing. Now, sometimes the flu season is early. We think that the immunity from influenza vaccine does wane even over the flu season. So if we end up having a late flu season, which we had in reality prior to COVID, they would often have late January, February, even March influenza peaks. If you've gotten your vaccine in September, it may not hold you over. So it's always a bit of a challenge in the timing. But I think it's safe that late September, early October, that would be my guess. Sometimes even later, but that would be my guess. Remember, generally speaking with vaccines, it takes about 2 weeks following a vaccine to have developed the immune response you would expect.
That's a good thing to know.
According to the CDC, they found that nearly 7% of American adults have ever had long COVID. And long COVID is defined as a chronic condition that occurs after COVID infection and is present for at least 3 months. A study found that long COVID can involve up to 200 different symptoms, which is a lot. And I'm wondering, are there the most common long COVID symptoms for people to be aware of?
I think the symptoms that I see as most common, certainly fatigue, people
Mhm.
call brain fog. Another one is so-called post-exertional malaise. Now, for normal people, you do a workout and you feel kind of energized after it. One of the key symptoms in long COVID, as well as similar illnesses like chronic fatigue syndrome, is that they develop this post-exertional malaise. So instead of feeling energized after a workout, they're completely exhausted, and that exhaustion lasts for a few days. Those are probably the most consistent symptoms. But just as you point out, there are so many different symptoms that have been associated with COVID. I almost haven't heard of a symptom that's not been associated with long COVID, which makes it difficult if we don't have a biomarker. So how do you know that you're dealing with a similar illness in people when there's all kind, well, the common thread is I've had COVID. And so it's very difficult. It remains a very challenging problem to solve.
What do you recommend to people who think that they may have long COVID?
Yeah, that's really a challenge. Certainly speak with your physician about it. Again, there are these long COVID programs without any firm way to truly confirm a diagnosis, but it's really a matter of things like physical therapy, those kinds of rehab options, sometimes with, if there are specific neurologic symptoms or respiratory symptoms, referral to a neurologist or a pulmonologist, but it remains a very difficult problem. We don't really have a treatment because we really don't understand it, frankly.
Finally, is it possible through lifestyle changes or supplements or changing your diet to boost your immune system against COVID-19?
It's kind of a popular thought in society. You buy over-the-counter things that claim to boost your immune system. I don't know what that means. I don't know that any over-the-counter product, since it is over-the-counter, that they have any kind of proof that this kind of stuff works. Do we have immune boosters in medical practice? Well, sure, but the immune system is a very complex system in our bodies. It has multiple arms. So we have certain agents that can increase certain types of white cells, for example. So immune boosting is a very nebulous concept. I'm not sure quite what it means, but it's certainly not something that over-the-counter medications or even that we really understand how dietary changes can boost immune system.
The answer is not in the TikTok shop, probably.
No, not really.
How is COVID different than when all this started back in early 2020?
I mean, it's dramatically different. Not only is the fact that so much of the population is now immune, we have an immunity to COVID that clearly improves our response to another episode of COVID. Back in March, April of 2020, when we were in the thick of it, just as it really hit, if you got hospitalized here or anyplace else, the chances of dying from COVID were around 20%, pretty high.
Mm.
So now it's so much different that the numbers of cases we're seeing in our hospitals is much lower, and the deaths from COVID, actually due to COVID, are much, much less common. But that's something we're studying right now, looking at why did people die early when they had COVID, and now if they get hospitalized and they have a COVID diagnosis, are they actually dying from complications of COVID, or is it just we happen to diagnose COVID and then you're dying because you have other medical problems, which we believe is, and our data would suggest is much more likely. So it's a very different landscape to where we started, which is obviously very good. So the important concept, though, is that for people who are older, sicker, COVID still remains a danger. And we do have effective vaccination. We're likely to have one coming, the next booster within weeks. And people with these various medical conditions and so forth should strongly consider getting vaccinated.
Be sure to check the show notes for additional resources, including the link to the Living Well blog, where we publish full episode transcripts.
And as always, if you enjoy our podcast, we truly appreciate a rating on Apple, Spotify, or wherever you listen to podcasts. Fun fact, the full episodes are also available on our YouTube channel at Jefferson Health.
Production support for today's episode provided by Brittany Rafalak and Barbara Henderson. We're your hosts, Carly Williams
And Jess Lopez. Be well.